Hey viewer, how are you? I hope you're staying safe and healthy there. So today, I'll be sharing with you information about glucocorticoids, specifically beclamethasone. Are you ready? Let's start. Beclamethasone is a generic name of a drug that belongs to glucocorticoids. It has brand names like Beclovent, Biconase, and Biconase AQ. Its chemical name is C22H29CiO5. Now let's proceed to its drug classifications. First up is the therapeutic classification. Beclamethasone is therapeutically classified as an anti-asthmatic. However, the pharmacologic is glucocorticoid and beclamethasone belongs to pregnancy categories. Let's proceed to the mechanism of action. Beclamethasone prevents or controls inflammation by controlling the rate of protein synthesis. Now, let's proceed to the pharmacokinetics. Drug is absorbed primarily through the nasal mucosa with minimal systemic absorption. After oral inhalation, drug is absorbed rapidly from the lungs and GI tract. Next is distribution. About 10% to 25% of nasal spray or orally inhaled dose is deposited in the respiratory tract. The remainder deposited in the mouth and oropharynx. When absorbed, it's 87% bound to plasma proteins. Metabolism. The portion inhaled into the respiratory tract is partially metabolized before absorption into systemic circulation, mostly metabolized in the liver. Lastly, excretion. When drug is administered systematically, its metabolites are excreted mainly in feces via biliary elimination and to a lesser extent in urine. Let's go to the indications of glucocorticoids. Beclamethasone is indicated to treat asthma, seasonal allergies, or perennial allergies, including allergic rhinitis. However, it is contraindicated to allergy to any component of the drug, acute infection, diabetes, other endocrine disorders, and pregnancy. So now, let's talk about the common side and adverse effects per body systems. In endocrine, common is dysmenorrhea. In respiratory, common are pharyngitis, rhinitis, hoarseness, throat irritation, upper respiratory tract infection, and dysphonia. In gastrointestinal, oral candidiasis of mouth and throat. In hypersensitivity, reactions including rashes, urticaria, pruritus, and erythema. Next, in nervous system is headache. In dermatologic, rash and purpura. In musculoskeletal, myalgia, muscle cramps, and back pain are the common. In cardiovascular, common are chest pain and edema. In local, expect that inhalation site sensation and taste sensation are common side and adverse effects. Lastly, in metabolic, increased weight. Now, we're on the last part of this lecture. Before administering the drug, the nurse must obtain complete health history, including allergies, drug history, and possible drug interactions. During administration, the nurse must evaluate lung sounds and respiratory rate, monitor for usual signs and symptoms of infection, and instruct the patient to use cautiously with hypertension, gastrointestinal disease, and congestive heart failure. After administering the drug, advise the patient that medication should not be used during an acute asthma attack, and instruct the patient to monitor temperature daily, and to notify healthcare provider of any tarry stools, edema, dizziness, and difficulty in breathing. Instruct the patients to report to healthcare provider the first sign of sore throat. And lastly, instruct the patient to monitor blood sugar closely and to report blood sugar elevations to healthcare provider. That's all for Beclamethasone. Thank you for watching. I hope you learned something. Bye!